My topic is genetic polymorphism in tumor suppressor and DNA repair genes that increase the risk of breast cancer development in Bangladeshi population. So, just maybe I will cover this a few keywords: breast cancer, tumor suppressor, and DNA repair genes. Tumor suppressor means TP53, and DNA repair XRCC1 and 3. And this TP53 arginine 72 pro, XRCC1 arginine 399 glutamine, and XRCC3 threonine 241 to methionine single nucleotide polymorphism and risk association with breast cancer in Bangladeshi population. So just this is a slide that what does breast mean to us. It is very much, sometimes it becomes relative. For a woman, this links to her identity as a woman, her sense of femininity, and her role as a mother. And breast cancer, what is, I'm very, I don't need to go there, but very simply I will skip this one. That's abnormal growth and without, in the breast tissue and without normal control that forms any form of tumor. And global crisis about, this is Globocan study, status of 2020, that every 19 seconds, one woman in the world becomes diagnosed as breast cancer, and every minute one dies all over the world in total population. And breast cancer accounts 1 in 4 cases. This is incidence, and 1 in 6 cancer deaths. And 90% of the new cases and deaths all over the world, it goes to low and middle income countries. So that's why my focus is in Bangladesh, female breast cancer scenario. Here is also the same scenario, and breast cancer is the top leading cancer. And yesterday we have seen in the presidential symposium, our respected honorable president presented among more than 3,000 data, Bangladesh, we found the same, that breast cancer is the top leading cancer. And every year, Bangladesh, this is global status, more than 8,000 female dies from breast cancer in Bangladesh. And I'm not sure what is the real picture. It might be more if all data we can get here. And more than 50 million women are at risk, at high risk in Bangladesh. So these are the breast cancer risk factors we know very well. I will not go there. These are manageable. For example, obesity, exercise, these are the lifestyle related. And now I'll tell you some factors that are unmanageable, because this is age, family history, radiation, treatment with DES, menstrual history, reproductive history, race, and the final is genetic alteration. This is my focus. Among the genetic alteration, what DNA methylation, overexpression and downregulation of different type of oncogene and tumor suppressor genes are culprit. Gene mutations we know very well, I will not go there. And my point is genetic polymorphism, single nucleotide polymorphism, what happens here. So these are the TP53, XRCC1, XRCC3, and so many genes have been found, and their polymorphism have been shown to be associated with breast cancer development all over the world. So here are the genes, not limited to these. These are the example of some genes: BRCA1, BRCA2, CDH1, STK11, P10, TP53, XRCC1, 2. These have been found to be, their mutation and polymorphism have been found to be associated with different types of cancer. My focus is TP53 and XRCC1 and 2. Let me show you that these two genes. One is TP53 located in chromosome 17, and XRCC1 is chromosome 19, and this is XRCC3 as chromosome 14. And TP53 usual functions are DNA binding, DNA repair, and apoptosis. Actually, mainly by apoptosis, playing apoptotic role, this gene protect us from carcinogenesis, and alteration in this gene hampers apoptosis that lead to cancer. And DNA repair genes also are responsible for repairing DNA damage. And if there is something abnormality in the protein, it affects the DNA repair function and it leads to cancer. Just I will show you that what is single nucleotide polymorphism. This is single nucleotide polymorphism because for example, this is a genetic variant at a single base position in the DNA. That means, for example, this man has A here, this man has G, or this one has T. This type of things, different, this is not mutation, and it is germline substitution of a single nucleotide at any position for different population. And what happens as a result of this one, as a result of this sequence change, it leads to different protein. That protein is altered, their function, and it may lead to different type of causes. So my three SNP, I have checked in this to find out this association with breast cancer scenario in Bangladesh. This is one. Here we can see that this G2C transition causes arginine to proline amino acid change in the TP53 protein, and it leads to apoptosis, apoptotic cancer, but apoptotic function is altered here. And XRCC1, this is here happens for G2A transition, it causes arginine to glutamine transition, and here C2T transition, it causes threonine to methionine transition. These are missense variation. This missense variation causes protein change, and in the world, all over the world, lung cancer, gastric cancer, cervical, and all sorts of cancer, we have found association of this polymorphism, but we don't know what happens in breast cancer cases in Bangladesh. That's why my objective of my study was to find out that how TP53 arginine, these three SNP associated with breast cancer susceptibility in Bangladeshi population. This was my methodology. We selected desktop study. We selected this SNP. We then took ethical approval, instant consent form, and volunteer selection. We collected venous blood and information. And then genomic DNA was isolated. We performed PCR and RFLP technique. And then finally we analyzed our data. And so 135 and 25 patients we took here, and this was the technique. We found out the DNA here, and the results are here that we found, check that DNA by PCR and biodrop, and here is the PCR data for TP53, and this is for XRCC1, and this is for XRCC3, and finally this is table shows the demographic data. And here we found Hardy-Weinberg equilibrium. It didn't deviate from this one. And for TP53, we found significant risk factor, chi-square study. 2.5 times risk was increased by pro-pro genotype. And allele frequency, pro-allele showed 1.5 times increased risk. And we found non-breastfeeding cases was associated with 23 times increased risk of breast cancer. And this is for XRCC1 and 3, 1.7 times. This compared to wild type, arginine, glycine, and this type to 1.7 times, 2.4 times, 1.9 times. And here XRCC3 also increased 1.8 times risk and 2.2 times, and the methionine allele increased the risk by 1.7 times. And here also we found with association with age and menstrual status. And here we found also with age and the diabetes and non-diabetes status. And in summary, we can say that these three polymorphism, XRCC1, XRCC3, and TP53, these have been found to be significantly and statistically significantly associated with increased risk of breast cancer development susceptibility among Bangladeshi population. And we found also with TP53 that association was related with breast cancer risk. And finally, my take-home message is genetic variation in TP53, XRCC1 and 3 genes might play important role as predictors or predicting markers for breast cancer risk. And this is my Kolkata University and National Institute of Cancer Research Institute. I express my acknowledgement. UGC funded this project, and Kolkata Medical College also from hospital. I want to acknowledge because I collected data from them, and this is my team. Thank you very much for patient hearing.